Nazo Peerzada is a resident of Karachi city. With more than 30 years of experience, she has dedicated her life for the betterment of maternal and child health issues. She volunteers with a charitable organization twice a week in designated hospitals, providing support to poor families during childbirth. While COVID-19 impacted Nazo's community in many ways, the financial hardship was one of the key concerns. Nazo contacted charitable organizations, government departments, and philanthropists for fundraising. Responding to her call, people donated generously and she was able to distribute rations amongst 115 families, which supported them for more than 2 months. Next, she decided to educate her community to follow SOPs to stay safe from the coronavirus. For this purpose, she conducted various awareness sessions. The information shared through these sessions was based on the global guidelines of WHO related to COVID-19 response and was adopted by the Ministry of National Health Services, Regulations and Coordination, Government of Pakistan. The ministry had published these guidelines on their official website, translated into local language for general public. Nazo provides counseling services to mothers-in-law and husbands to ensure that pregnant women avail at least 4 antenatal checkups. Most of the times she has to accompany them to hospital as well. She also helps families understand the importance of exclusive breastfeeding, especially during the first 6 months after childbirth. Ensuring timely vaccinations for mothers and babies is also a task that Nazo proudly takes on. During the pandemic, she attended to nearly 30 pregnant women. Another challenge faced was that due to lockdown, the nearby hospital was shut down. There was no public transport available either, and the hospitals were quite far away. In this situation, the rickshaw drivers of her community stood up and offered their services voluntarily. During the times of pandemic, a woman waiting in a queue for ration fell down. Soon after, she started to bleed. The family contacted Nazo for help. The woman needed to be taken to hospital. A rickshaw driver from neighborhood came forward and took them to the hospital. Her condition worsened due to heavy bleeding. The rickshaw driver, after much effort, was able to bring a donor, and after several hours, they managed the blood transfusion that saved her life. During the pandemic, the Family Planning Center in Nazo's community had also closed down. Nazo went to meet the staff of the facility and requested them to arrange the supplies. After repeated follow-ups, finally the staff agreed to help and ensured the provision of the supplies. Nazo believes that our life has a purpose. We all earn money for ourselves, but there is a need to share our resources with others. If one person takes responsibility of one deserving household, Nazo believes we can help eradicate poverty. That makes poor families more vulnerable during catastrophes such as the COVID-19.